Okay. Hi, Namaskar. We are speaking from Fortis Healthcare, and it's a pleasure to welcome all our panelists and all our senior pulmonologists from our Fortis network of hospitals, and especially in Delhi NCR. You must be reading in the papers about pollution, air quality index shooting off the roof, grab 2 being imposed. That is not so across the country, like Chandigarh. It's a nice thing. Even in south, in Chennai, I think that we don't have that problem. Hyderabad also is good. Mumbai is little much better than Delhi NCR. But the primary issues are coming up in a big way. So we have a esteemed panel today. We have Dr. Digambar Behra, who is the former professor and head of the Department of Pulmonology at PGI Chandigarh, who did immune service there. In fact, under him, the DM Pulmonology started there, and now he's with us at Fortis Healthcare in Mohali. And welcome, Dr. Behra. We have Dr. Ravi Shekhar Jha, Director of Pulmonology from Fortis Escorts Hospital, Faridabad. We have Dr. Shushmi Roy Chaudhary, Director of Pulmonology from our City of Joy at Kolkata Anandpur Fortis Hospital there. We have Dr. Govini, who will be joining shortly. Dr. Pankaj from clinical group with the assistant company of Fortis Healthcare. She's from Hyderabad, Clinicals Hyderabad. And she's very much involved in pulmonology as well as the lung transplant program. And we have Dr. Mir Gangakhitkar from our financial capital, Mumbai, Fortis Hospital, Mulund, who is a senior consultant, the leading pulmonologist from of Mumbai, in fact, and he's actually with us. So we'd like to start the panel discussion. Welcome everyone. With Dr. Behra, in fact, there's no better person than start with him. So, Dr. Behra, just what we'd like to ask you is that what are the most common long-term impacts of air pollution on lung health that you observe in your patients?
I think Sir is offline.
So I'll come. Okay, I'll come to him later. I just Ravi, I'll go off to you now. Over to you. Is that how can people differentiate between pollution-induced respiratory symptoms and allergic reactions? Because a lot of times there's a sort of a gray area there between the pulmonary symptoms from pollution-induced or certain allergic reactions which happen.
That's actually a very relevant question. The question that is being asked to us on in our day-to-day practice, and we can. What is the? There is one thing which can easily differentiate if the respiratory symptom is because of allergy or because of pollution is mostly pollutant cause mechanical irritation of the airways. So even if someone has no allergy history, is exposed to pollutant, patient or people may suffer eye irritation, may suffer respiratory distress, may suffer cough or otherwise chest tightness. While allergic symptoms mostly are limited to a specific weather or specific allergen specific triggers. So most of the people, if they are asthmatic or having allergic rhinitis, they suffer problem during the harvesting season or pollen season. While those who suffer from pollution-related diseases, they mostly suffer in the months of winter or changing weather. So that is how one thing how we can differentiate between both things.
Thank you, Ravi. Come back to Dr. Behra. We just had lost connect with you. Is that what are the common long-term impacts of air pollution on lung health that you observe in your patients?
Thank you. Good afternoon. Sorry for the disconnect. The long-term effect of air pollution on lung health is to start with. Actually, it affects the lung growth in the if you are exposed to the in the early childhood or during the lung growth phase, particularly in the till the age of 14, 15. And the second important effect will be the reduction in the lung function. the overall lung function is reduced in the form of its vital capacity, the ratio of FeB1 and FBC, the total lung capacity, diffusion. So all the parameters of lung function are reduced significantly. Number three, the existing lung diseases. Say, for example, if somebody having any chronic lung disease, so they get aggravated. The other direct effect of pollution on various lung diseases, particularly those likely to develop are bronchial asthma, then COPD, and lung cancer. So these are some of the long-term effects of pollution on lung health.
Okay, thank you. Uh, Dr. Sushmita, coming to you now is that are women and children more vulnerable to pollution related lung diseases? And if so, why?
Thank you, sir. Thank you for having me. Just as Dr. Behra just said, that in children, they have developing lungs, and any exposure that happens early on in childhood basically means that it is going to go ahead and cause more damage, because these are A, growing lungs, and B, the immune system is not that uh, robust. So if we start with infections in children, it's they are much more at risk of catching respiratory syncytial virus like infections, which can cause asthma like symptoms, but not really asthma. Lots of children are not completely vaccinated as well, so vaccination is recommended in all of them to improve their immunity. The second thing is, both in children and women, the lung airways as well as the surface area of the lung is much smaller compared to men. And the same amount of exposure of either a pollutant or smoke will cause much more damage in them. And so they are at increased risk, especially in children. Those who go to school and are standing in a polluted road for a very long time and are inhaling the same pollutants on a daily basis are at higher risk of developing diseases like COPD early. So these are things to be thought about. In women, again, because of social reasons, even now a larger part of women in countries like ours live in the rural areas and are still using biomass fuel. And biomass non-tobacco smoking related exposure not only increases their chances of COPD, but also non-smoking lung cancer is significantly rising in our country because of these things. So definitely they are at higher risk, and the preventable risks should be addressed and taken care of to prevent long-term damage.
Thank you. Dr. Tapashwi, coming to you is that
Yes.
how can intervention pulmonology help in managing chronic airway diseases caused by pollution? Is there any role in intervention pulmonology to tackle those who suffer from pollution? I think you are mute. Sorry.
Good evening, everybody. Thank you so much, sir, for having. Thank you so much for having me here, sir. So, as an interventional pulmonologist and basically a pulmonologist per se, I'd say we definitely hold a big role in treating patients with chronic lung diseases, especially due to pollution. So, we have a diagnostic role as well as a therapeutic role. So, our role as pulmonologists starts from preventing the disease, trying and detecting the disease early, especially diseases like lung cancer and COPD, which we can start early by performing pulmonary function tests, cardiopulmonary exercise testing, so on and so forth. Especially imaging studies like chest X-ray and CT scans are also advocated by interventional pulmonologists. And per se, let us say for an interventional pulmonologist, we have a diagnostic as well as a therapeutic role. When it comes to the diagnostic role, we are involved with doing what is called as a bronchoscopy, which is we send a camera into the airways and check for any abnormalities, look for mucus plugging or any growths. Whereas when it comes to a thoracoscopy or a pleuroscopy, we check the lining of the lungs to check for any empyremas, any growths, or detect tuberculosis or lung cancers, especially mesotheliomas, which are caused by asbestos exposure. That is again chronic pollution exposure, we should say. So transplant pulmonologists and interventional pulmonologists have a big role when it comes to chronic diseases, especially because of pollution. So we help also in deploying endobronchial valves, which reduce the lung volume, which is increased especially in chronic bronchial emphysema patients, COPD patients with emphysema. These are the patients who benefit from interventional procedures such as endobronchial valves. That's how as interventional pulmonologists, we contribute to chronic lung diseases because of pollution.
Thank you. Uh, Going to now the financial capital to Mulund, Fortis Mulund, Dr. Ganga Ketkar. Giving the rising pollution levels that we are seeing, especially in the cities, uh, more in Delhi NCR, if I can call it. Mumbai also has been having that. Kolkata has been having that. And so, what is the message that we can say to our adults and children? And how do we monitor the? Because asthma is another thing that's on the table. But when you look at pollution, adults who are, and children who are suffering from asthma, what will be your advice, and how do you manage that daily exposure to harmful air pollution? Because these are some sort of advice that we need to sort of spread to the public at large, because some things are not under control. Pollution is happening, but we have to live. So, as a healthcare provider, we have to take care of people. So, in your opinion, what is the advice that you will give to the public at large, to the elders, and to the adults for their children who have asthma also?
Right, sir. Thank you for having me on the program. So I heard from the start that Delhi has been taking the cake as far as pollution is concerned, but Mumbai isn't really far behind. We have a lot of construction. We have a lot of buildings that are being reconstructed. You've got metros coming up everywhere, so there is a significant amount of particulate matter that we have too. And yes, it's a big problem for all our asthmatics, children and adults alike. It's difficult for an individual on his own basis to identify how much exposure he or she has. But we do have access to a lot of information nowadays online. So checking your air quality indices in the city is something that you can do with relative ease now. You do have some devices which we all know popularly as air purifiers, some of which also give a rudimentary index on their own screens also. So having an air purifier to get out larger particulate matter often comes with these side bullets where you can see some of these indices. As far as self monitoring and understanding how you are behaving with respect to your own disease, it's something that is recommended world over also, that you can use a peak flow meter which helps you understand how well you are tolerating the levels of pollution in your city and your surroundings. Additionally, as our co-panelist Dr. Tapaswi has already said, prevention is important. So, using your common sense to understand when it's likely to be more polluted. So, if you have a heavily populated area, you want to probably go out for walks at times when there is a lesser vehicular population out on the road. Maybe using a mask in such situations might also help you better. And for for with a growing population, probably trying to use public transport more, carpooling rather than going on two-wheeled vehicles, where your exposure definitely is much higher, is something that you can try. So prevention, uh, trying to monitor it with available public information, and on your personal level using peak flow meters to check how your asthma is controlled would be the way to go about it.
Thank you. Ravi, I'll come to you now. Is that how does poor air quality impact patients with sleep apnea or other sleep-related breathing disorders?
Yeah. So just today I came across a patient who was using auto CPAP for maybe more than 1 year, and she was telling me that for the last 4 or 5 days, the same machine on which she was comfortable is not working properly anymore. So I examined her, found a lot of rhonchi in her chest, and I finally concluded that her actually asthma had worsened. CPAP machine was same, and her sleep apnea had worsened because of the worsening of asthma. She has basically two diseases: asthma as well as sleep apnea. So there is one common disease that is called overlap syndrome, where COPD patient and asthma patient can have sleep apnea. All these patients, when their airways are exposed to air pollutant or pollutants, they suffer some kind of laryngeal edema, some kind of airway edema, which can worsen their pre-existing sleep apnea. If the patient already has asthma, if they suffer asthma attack or COPD attack, again their sleep apnea can worsen. So a worsening air quality can definitely worsen our sleep apnea. Just 4 or 5 days back, I was with Dr. Sushmita. I met for a conference in Shillong, and I was very, very kind of surprised to see how our lungs are exposed to so bad in Delhi NCR, and it was the air quality index at Shillong was just 40. So I wasn't used to with that much good quality of air, so my lung was not able to adapt to such a good quality of air. So that was a very, very strange thing for me, because in this weather I have never visited a state with such a good air quality. But again, the moment I landed up in Delhi, I started burning. So I felt that our lung adapts so nicely to good air quality rather than bad air quality, and that is why it is very important that for all airway diseases, including upper airway, lower airway, anything where air goes in, we need to protect it from any kind of air pollution. So sleep apnea certainly worsens with worsening air quality.
Thank you. Sushmita, Dr. Gangakhetkar just referred to it in the passing about air purifiers, because when you go to the malls and markets, you see a lot of air purifiers being sort of marketed. People will be coming into us, sir, ma'am, take this. This is very good for your health. Protect yourself. So, what is your opinion about air purifiers and masks in reducing exposure to allergens and pollutants?
Thank you, sir. This is the most frequently chat GPT, first consulted and then asked question in our OPD these days. Can we buy a air purifier? And if we can, then what should we be like? So basically, in theory, air purifiers should help, especially only with particulate matters. But again, it depends on the quality A of the filters used, because HEPA filters will decrease the size of pollutants. It will capture dust, smoke, and etc. And size is less than 2.5 pollutants. But again, the quality of the filters, again, the purifier and the size of the room also matters. So it's very difficult to say that you buy a air purifier and you'll be safe. It might help, but then they have to look at the size of the room and the quality of the filters, and also the quality of the purifier that they are buying, which is very difficult for us at this point in time to advise what is good and what is bad. It'll be individualized. The easiest thing to do is avoidance and prevention. And as we have all been saying since the time from COVID times, is that a blue mask or a surgical mask is good enough to curtail or to take away dust size particles about 5 microns or so, and a light surgical mask is good enough. And I still recommend that whenever people are in crowded places or during polluted areas, children who have to wait for buses by the side of the road for 20, 25, 30 minutes in the morning or coming back, it is best in crowded areas and polluted areas still to use a blue mask, especially for people who have asthma or COPD or are vulnerable to catching respiratory infections and in highly polluted areas. So those are our recommendations. The cloth mask only takes away dust particles. It doesn't help reduce the size of pollutant, catch anything else other than that. So it is best to use a blue mask if you are susceptible and you are in heavily polluted areas. So that would be our recommendation.
Thank you. Dr. Tapashwar, just a follow-up of that, again, same thing is that what lifestyle changes can significantly improve respiratory health in high pollution areas? Is there anything that, because if we can't take control of the environment, it's not within our reach.
Yes.
There are other factors outside. But what is the advice that you'll give to the common public at large, your patients, that do this, at least so that at least some amount of safety is there.
So I would be amalgamating everything that all our colleagues have told right now. Outdoor strategies, indoor strategies, and some additional strategies which we have to take care personally. So the outdoor strategies would be try and maintain an air quality app. Try and find out where the air quality is very bad and protect yourself with, like Sushmita madam already mentioned, with the mask, a blue mask or an N95 mask, depending on what the place warrants, and try and avoid going out when the air pollution index is pretty high. That is peak traffic times. The air pollution index tends to be high. Try to avoid those routes. If you can take an alternative route, depending on the air quality at that time at that particular place, especially people with bronchial asthma and COPDs who have tendency of exacerbation in case they get exposed to this high pollution. So apart from that, try and avoid volatile organic compounds such as paints, pesticides, and perfumes, which tend to cause allergic reactions in patients or general public as well. So this has to be taken care of in the indoor areas. When you're exercising, also try to do it in fresh air rather than wherever there is higher amount of pollution. Apart from that, taking care of yourself. Try and avoid tobacco smoke first hand or second hand. You shouldn't be exposed to tobacco smoke, which will worsen your lungs, especially when you are exposed to pollution and you have chronic lung diseases. Try to keep well hydrated so that mucus respiratory vaccinations. Vaccination play a very important role. So keep up to date with your vaccinations. Try and use indoor HEPA filters and air purifiers. Try to take a diet which is rich in vitamin C and vitamin E, which will, along with antioxidants, especially berries and citric acid, citrus fruits, which will help you. So diet, vaccinations, and protecting your airways will take care of chronic lung diseases patients and help people, general public, not even get chronic lung diseases.
Okay, thank you. Dr. Ganga Khitkar, just asking something is that what are the emerging technologies or treatments in pulmonology that aid in early detection and prevention of lung disease? Anything that you think that the public should know at large?
It's an
Any
interesting
equipment?
question, sir. So, emerging technologies, you have a lot of wearable devices now available. So, we will be researching one such device hopefully soon at our center as well. And these wearable devices give us significant amount of information about how the patient is doing, even during their sleep and even while their day-to-day activities. So wearables is something that we have as newer technology for understanding oxygen, their sympathetic tones, how well they're sleeping, all of those things. uh, there is no discussion as far as new technologies is concerned without the mention of artificial intelligence. So, artificial intelligence is likely to help us, at least in our country, where we have a large land base, but we may not always have doctors everywhere. So, radiology is one place where we could probably have a large bank of artificial intelligence trained monitors, which could tell us as to whether a patient genuinely has a disease and get them for referrals to higher centers as may be required, even without there being a trained doctor or a qualified physician to actually see the X-ray or the CT at that point at that location if the technology has reached. Uh, Additionally, with every new app that we develop on our phones, we have more and more information which we can provide to patients. We have certain meters that are now just connected to the patient's phone. So, even for that matter, doing almost a comprehensive pulmonary function test can be possible at a desktop device or a device which is attached to a patient's phone. So, certainly a lot of emerging technology and a lot to look forward to in the coming years.
Thank you. Dr. Ravi, just want to ask you is that See, we are in Delhi NCR, although Faridabad AQ has just dropped. I was looking at it just now. It's 125 today, just now. So just having a look at that, Delhi is still high, it's 300 plus. So what is the advice that you will give to the common public on how do you take care of your daily activities? Like people go for the morning walks, evening walks. Is it right to go? Which age group are the ones who should avoid, say, a early morning walk? Um, or they should not even go for the evening walk. And then the other thing is, what is your message on the immunization piece of it? Because there's a lot of things that are there which can protect if people are immunized. So there are two parts to this question. So if you could just say that, it will be a nice thing for the public to know at large.
Yeah, so there are two very specific things that whenever there is anyone who has got some respiratory problem, if they are going out of their place, they should always check AQ, and if it is bad, they should avoid going. Second thing is they should try to avoid the peak traffic hour because pollution is mostly maximum when there is peak traffic or peak office hour. Third is whenever there is smoke outside, they should try avoid going outside. And fourth, very important thing is I've seen many patients who feel that when they exercise, their lung capacity will go up, but that is actually a little contradictory here because if someone is exercising, they will inhale more air, more polluted air. So whenever there is pollution outside, AQI is bad. They should avoid doing any outdoor activity or any outdoor exercise. They can exercise inside in their house. And again, it is very important, like Sushruta ma'am said, wearing mask is very, very important. Using air purifier whenever you are inside your house is very important. It can prevent you while you are in your, you can place a good quality air purifier in your bedroom. You can also place some indoor plants. Again, one very important thing, there's a concept that is called locked in air. So people may feel that whenever they keep their room or house completely windows closed, they can be completely safe from pollution, but that doesn't happen like this. They need to open the window for at least 1 hour in the daytime when pollution is minimum for cross ventilation loss, so the locked in air effect can be prevented. Even while you sit in your car, which was parked in the daytime at any your office place anywhere, whenever you sit in, make sure that we roll down the window, let the air cross ventilation happen, then only we roll up the window. So these are some common advice that can be given to the patient. And other than that, of course, the advice for nutrition, lot of hydration, antioxidant rich food is very important. Now coming to second part, that is a vaccination part. Flu vaccination is mandatory, recommended for almost everyone, even if someone is not having any respiratory problem. And pneumonia vaccination, especially conjugate vaccine, again is very important, especially if someone is having any kind of respiratory disease. COVID booster vaccination, I am not recommending to anyone nowadays. I don't know what others are practicing, but I am not recommending COVID booster vaccination to anyone nowadays. Tdap vaccination, very important vaccination that is to be given to healthcare workers and those who are having any kind of respiratory problem. So generally speaking, flu vaccine and pneumonia vaccine are very, very important, especially conjugate vaccine is very important to be given to almost everyone who is having any kind of respiratory problem.
Thank you. Coming now to Dr. Behera, is that he's one of the senior doctors in our network, and he's really on a lot of the lung disorders that we talk about. There's a lot of talk about building up a good lung program. So, in your opinion, if you develop a lung transplant program in our setup, the Fortis Clinic is also has a recent program going now. What is the advice to these lung transplant patients? What they should adopt? What are the preventive strategies they should adopt from the airborne pollutants and allergens? Because it's important that the advice of what we give, because while we say that we want to build up a lung transplant program, say in Delhi NCR, in Punjab, in Kolkata, in Mumbai, Chennai, Hyderabad already has it. What is the advice that we should, because the public at large should know if they have got lung transplant now. So, what are the things that they should do to avoid any deleterious effects from the pollutants and allergens that are there?
You see, I don't think we have any specific advice to them, as apart from that, was already the other colleagues have already spoken about. For it may be true for any patient or for any individual how to avoid and how to, as far as possible, how to reduce the pollution, how to avoid, what are the different ways. I think they are already been told. The only issue with the lung transplant patients is they should be very strictly following that. In that sense, as we told and as we discussed, the air pollution produces a lot of things, lot of changes. Then the deterioration of the existing lung function or any other chronic lung issue they have got. So obviously they will be aggravated and they will be somehow, if you can, then you have to try to avoid that. And all these measures have already been told to them. The only extra thing they are on heavy immunosuppressants. So all those precautions for any immunocompromised patient is to be taken. So that much only I say, but I don't think for there will be any specific advice to the lung transplant patients, except that they should be little more cautious and more careful in comparison to other patients or other individuals.
Thank you. Uh, Sushmita, just because Fortis Kolkata is in the, you've already listed out some recipients who are waiting for lung transplant. You are waiting for available donor, disease donor. So, what are the types of cases actually that finally you all list out for who in the lung transplant list, the recipient list? Because Eastern India doesn't have a lung transplant program, unlike South where Hyderabad, Chennai is very good. But in Kolkata, if you to start it in Eastern India, because this our message should go to the public is that these are the subset of patients who can benefit, and so do follow up in a hospital which has a community backup to take care of them, and when required, they can be once they are listed, they can have a lung transplant. So I think so that there's a little bit of knowledge deficit, I can say, in the public at large on which are the cases that require it. Over to you.
Thank you, sir. Yeah, I think it's a very pertinent question in today's context that we do have availability of, a lung transplant program available, especially for people who have end-stage lung disease and are unlikely to survive unless, despite maximal treatment options available to them, and it is usually for chronic lung diseases. So which is why we run basically a lung failure clinic. And lung failure can happen because of a number of lung diseases, especially COPD, long-standing bronchiectasis, in much younger people, cystic fibrosis, and the commonest cause these days in our country is interstitial lung disease. So these are causes where they are at end stage. We evaluate them in the lung failure clinic. It isn't as if everyone who has end stage lung disease is going to be able to get new lungs, or who's going to be okay for lung transplant. We have to assess them in various areas. So we bring them to our lung failure clinic, we assess them, and then we have a multidisciplinary team which basically comprises of the physicians, surgeons, psychiatrist, nutritionist, radiologist, etc. And we all sit down and see if someone qualifies for it. We need to build up on their nutrition. We need to build up on their exercise capacity with regular physiotherapy, etc. And then list them. So people who have end-stage lung disease must get evaluated first at a lung failure clinic, have their maximal treatment optimized, and then see whether they fulfill previously laid down. These are not just national but international criteria, which if they fulfill, then they are listed for lung transplant.
Thank you. Dr. Tapashri, since you are involved in a very upcoming lung transplant program in Hyderabad with good outcomes, could you just share with the public at large that what are the challenges in performing a lung transplant and the preventive aspect of it? That can you delay it or avoid it? Uh, so if you could put it up in some layman's term for public at large to know.
Absolutely. So, since we have started doing lung transplants, the major challenge for us has been early referral of the patient for a lung transplant. So we are getting patients more so on a ventilator or with mechanical circulatory support, that is ECMO support, which is when we are hustling for an organ too fast. So my suggestion to all end stage lung disease patients would be, please get yourselves evaluated earlier so that we could register you for a donor early on, and we can optimize treatment for patients, optimize their other organs so that transplant outcomes are much better once we do a lung transplant. So that is when it comes to a patient who definitely requires a lung transplant. Whereas there are some COPD patients who can be medically managed and who can be rehabilitated such that they don't need to go for a lung transplant. So these are the patients who have to be detected earlier, patients who are smokers or who have been exposed to pollution or who have had occupational exposure causing COPD. We need to do serial pulmonary function tests, put them on optimal medical management so that they don't progress to a stage where they're oxygen dependent and where they definitely require a lung transplant. So, probably COPD, prevention of COPD, and proper medical management of COPD patients would definitely prevent lung transplant in these patients. And when it comes to interstitial lung disease, early detection of ILD, early detection of symptoms or watch out for symptoms such as dry cough, shortness of breath. We watch out early, and at the mild stage, if we can initiate antifibrotics, probably we would delay the transplantation process, especially in ILD patients. There are a lot of ILD patients who are maintaining on medical management and are able to stay on long term oxygen. And we, as a team, try to delay the transplant process as long as possible. That's the dictum that had been taught. Try and delay the lung transplant so that the older the patient, the longer he gets to survive after a lung transplant. So it's not that once a patient is referred for lung transplant, we take him up or her up immediately and try to put them on the list. We evaluate the patient extensively, see if a transplant is feasible and how well the patient would do once we are done with the lung transplant. Outcomes are of utmost importance for a lung transplant team to go forward, because nothing makes us more happy than seeing the patient smiling and walking out of the hospital without oxygen or without a tracheostomy. So, for that, we need the patient to come to us earlier so that we can optimize this patient well and we can make sure that he or she gets the best out of the transplant that they have chosen.
Thank you. Dr. Behra, I'd like to, we're nearing the end of our session today. So I'd like to take your feedback with your vast experience at PGI, heading the department, building up a vibrant pulmonology program there, now at Fortis Valley. So, what are your views on, of course, from Fortis, we're looking at developing a lung transplant program. So, is there something that we should be looking at? And in your opinion, what are the things that we should be doing to have that in place?
Uh, I think there is the one liner. I think my bottom line will be that yes, there is a need and a great need and urgent need of a lung transplantation program in this country. Unfortunately, it is not so, and it is not coming up very soon because of various reasons. Of course, there are reasons at our level, at the public level, the awareness. So, and as such, we should know, unlike many other organ transplantation programs, the lung transplant program has not cut up that way as it should be. There are a lot of patients who require or who will need lung transplant actually. As some of the conditions you have told has already been discussed, say for example interstitial lung disease, it is increasing like anything, and many of these patients, they will be requiring some sort of this organ replacement or organ transplant, if we speak that way. The various issues, as you told, as I think my previous speaker spoke about the awareness. Many, unfortunately, if we, it has been seen that even many of our chest physicians, they don't talk of about lung transplant. We don't even discuss the issue of lung transplant. Maybe partly because it is not widely available in this country. It is only, as very rightly you said, it is mainly confined to the some of the southern states, and in the northern states it is some people are doing, but not as a regular program. And I am happy to note that the Fortis group is trying to do that. In Fortis Mahali, we had initiated that, and I learned that we have got the go ahead, but it all depends upon Dr. Panigrahi, Dr. Bishnu, what he's doing and how he's going to help us out. The second issue is, the of course, one of the uh, other issues which was hindering us for lung transplant is the cost part, but I don't think that is no more an issue. People have got still can able to afford that cost part. The one more disadvantage which I see in this country is the lack of transplant surgeons, particularly the thoracic surgeon. To get a thoracic surgeon is a dream, and I think it is I should say it is a lifetime dream. And more so, the thoracic surgeon is getting interested in transplant surgery is that adds further to the issue. So, but otherwise, I think the organ donation by the people, it has gradually cut up. We have a strong network of organ transplant, the NATO, SATO, etc. I think they are working very well. I know the PGI has got a, while I was working in PGI, and even currently, I know they have got a very strong organ donation network. Even sometimes many other organs are not the lungs, of course, the other organs, they are being transported to other parts because the even in the institute itself there are not enough recipients, or there are lack of facilities is there. So in Toto, I should say there is a great need. Even in my own clinic here at Fortis Mahali, there are a lot of patients. I could, and I usually talk to the South Indian friends from the South India. So we talk, and then some of them have gone there and done their transplant, and many of the other patients they are quite eligible and they require a transplant, and they're interested to get the transplant. So I am sure the same experience from other parts of the country. It is obviously labor intensive. It requires devotion and a devoted team and a dedicated team. In fact, that is required. But all these facilities, I am sure, will be available, but it requires a lot of time. I know while I was working in PGI, and actually ours was we started the first lung transplant program in the government setup, or in the what we call the public setup. It was there in the private setup, but we started. But what happened? Our entire department, our entire team, and the everybody got engaged, and then we have lot other things to do. Like we have to look after the teaching, we have to do the look after other patient loss, other areas of the pulmonary care is required. So that's why what I'm trying, a dedicated team is required, and that is what I think the hospitals like ours now in Forty should take forth. And I think it is the ball is in the court of Dr. Vishnu.
At least everyone's baby, we will work on it. Thank you. Uh, I'll just ask one question, the same question to everyone. You can just in whatever order you want to do. The question is that, can early screening or, or lung function tests help in preventing chronic respiratory diseases amongst people living in polluted areas? Because it's a take-home message that I would like to hear from each one of you all. Yeah, so over to you, one by one. Please just say whatever you think is appropriate.
I'll go
You,
first.
please go ahead. Please go ahead.
No, sir. No, sir. You go first.
No,
Then I'll
no,
go after
please
you.
go ahead. No, no, go ahead. Go ahead.
Acha. Now, sir, regarding lung function, yes, definitely. Especially now, we are not talking of COPD. We are talking of conditions like CRISM, which is very, very early form, which might turn into COPD or other lung diseases, and pre-COPD status. So, a simple lung function test can actually identify people at risk and help them take appropriate, necessary steps to try and avoid it from becoming a chronic lung disease. If people have asthma, knowing whether your lung function is good enough or not, pure lung function tests are important, and they are all a part and parcel of annual health checkups, and they should be included in it. And other than lung function test, one more thing that I would definitely say, something that is lacking in most parts of the country, but we have started in our network in some of the hospitals, which will take a national way, I'm sure, in the days to come, is screening people who are at risk of developing lung cancer by low dose CT. It has certain parameters to be looked at, who qualifies for it, but those are things that are in the pipeline and are recommended by pulmonologists the world over, and definitely in our country as well. That will probably become some sort of a national program, not in such a distant future.
Anyone next?
Uh, yes, you see the as your question was screening through lung function. Yes, I think the answer will be yes. Even years before the patient becomes symptomatic, like so they start deteriorating the lung function till it reaches a particular stage when the patient becomes symptomatic. Actually, by the time they are symptomatic, already there will be, say for example, in COPD is one of the best examples. So the patient will have, by the time they come, obviously there are patients who will be having normal lung function, but there will be symptoms. But by and large, the lung function starts deteriorating before they develop their symptoms. So I think this is a very good idea, and in many centers, the the health checkup includes the spirometry. Unfortunately, what is happening in this country, in general, I am talking, they've been getting a spirometry for already established diseases. It is quite lacking. The although many people are now having spirometers, the spirometers are now available widely, and their cost has come down. But question is again, the as a practice, the many pulmonologists even don't practice doing spirometry. Although I should say the things have changed over the years, but I think in your one sentence, as Dr. Bishnu suggested, and he is asking the question whether it should be done. Yes, it should be done, and particularly in cases for the smokers, it to know to how the lung function. We know that the fall of the FeV1 or the so that will be a good indicator. Yes, it is falling fast. We can That will be one way we can convince the smoker. Okay, your lung function is deteriorating fast, so you just quit smoking. And of course the diagnosis of the disease earlier, many people they just wait till they become quite advanced, and then before they take consultation from a physician. So I'm sure there is definitely a role of lung function testing, particularly in the era of pollution, as we are all talking, so we can know that yes, the lung function is deteriorating.
So for me per se, I wake up to.
So in my area also, a lot of air pollution is there.
Please go.
I think yes. So
Ravi,
in
go
my
ahead,
area
please.
also, I have seen that because of very high air pollution, a lot of people who do not have any symptom, they come for normal routine health checkup. I find that there is a lot of spirometry engagement. we diagnose the patient in kind of pre-COPD stage, ratio and impaired spirometry. In one more common thing which I have noticed for last over the I've been practicing in the 10 years, but I've seen that now more and more early age, less cases are coming, like people who are in the age of 35 or 40 years old without any reversibility. That is how importance lung function screening is there. So I feel especially we should be able to do that regularly. Of course, if we do proper screening, a lot of disease can be avoided.
Okay, thank you. Dr. Ganga Ketkar, Dr. Tapashwi, I think there's a network
Yeah.
issue.
So I think the short answer is yes. Spirometry is extremely crucial. On a daily basis, I'm signing 5 abnormal spirometries for patients who have just come for a health checkup. A perception of whether you have a respiratory disease, unfortunately, is poor. We often attribute it to maybe I've put on some weight or I've been working too much, and you don't understand that it's actually an obstructive airway that you are developing with your exposure to pollution. So, have a look at your health checkup package, get the spirometry done, see what the interpretation is, and definitely meet a pulmonologist to understand it better.
Uh, Thank you. So it was a very informative session. I'd like to thank all the esteemed panelists. But some of the Tapashwi has come back. Sorry. Go ahead, please.
Yes, sir. Sorry for the disconnect. Yeah.
Quick, last.
So for someone like me who wakes up to spirometry readings every day morning for my post-transplant patients, yes, it's a window to their lung world. So I definitely vouch for spirometry, and we have done studies on traffic police who are exposed to a lot of pollution every day. So that's how my relation with spirometry started. Yeah, definitely it's a very good tool, especially the handheld spirometer. I think we should use it more to detect lung diseases early on and then refer to them for a proper pulmonary function testing. Thank you, sir.
Thank you. So it was, again, as I was saying, it was very informative. I think for the public at large, it's they should be aware that take care of your lungs because oxygen is the source for us to be alive. And how do we take care of it? A lot of good inputs have come from everyone. Uh, on pollution is there, but like Dr. Smith rightly mentioned, wearing a surgical mask. We talking about avoiding the time which is very polluted. Don't go at that time. I think you rightly mentioned. I think we start using more public transport and carpooling than going on motorcycle. So these are very important messages that are there. The regular health checkups and the pulmonary function test need to be checked. That's a very important part. I think so. A very important message I think so, which has come from Dr. Tapashwi, is it's a very important is that the traffic policeman, you mentioned police, the traffic policeman there on the road, whatever the shift is, 8 hours, 12 hours, whatever it is, the exposure that they have. So while you do see them now wearing masks, but I think so regular checkups should be sort of part of that thing that advice should be there that they should take. So we should see that how do we take care of them. The other thing that came up, I think so, is that Rashmi rightly mentioned about the low dose CT screening. It is sad that lung cancer is the second largest lung cancer incidence in males. After head and neck, lung cancer is the second largest in India amongst males. But the sad part is that we detect them very late in their stage, where it is not surgically operable, is more of a palliative care. So I think so the low-dose CT that Dr. Suspita rightly mentioned, that is something that across the network we are introducing this as an optional part of the health check packages. I think this is something that we need to do. I request all our community colleagues also to start pushing this also. That it has less radiation, but the good thing is that early pickup of lung cancers, which now USA it is mandated now. earlier that that's the data that's coming up that low dose CT has been able to sort of have a better outcome as far as lung cancers are concerned, the long-term outcome. So this is another nice message that is there, and I think I think so. We are looking forward to the wearables that you are talking about, and that is something that I think so. You can put it on your LinkedIn, on Facebook, and other social media because we are in a social media world now. So for the public at large to sort of know what are the wearables that they should use in this polluted environment that all of us have. Thank you, everyone, and again, namaskar, and thank you to all the panelists.
Thank you.